look at her, I noticed that she actually does have one fairly deep line that is directly opposite the outer canthus, and it's the same on both sides. You can probably see it quite clearly. She does have some other lines in the area, but she has that one prominent line just in the middle. So she wants to see if we can inject some filler, some dermal filler in that area to try to keep her from developing any more severe changes in this area. So I'm going to use a mid-dermal filler, and I'm going to try to see if we can elevate that area just a bit. I've already injected a small amount of Botox in this area to try to prevent her from actually forming these lines. I have given her 7 units on each side, and we're now going to try to inject the Restylane. So I'm just going to turn her head just to the side. We're going to start in the medial portion of this line, and we're try to stay as superficial as possible to see if we can really get some elevation here. And it's going to be sort of difficult to see, but I think you may be able to see just the little bit of elevation that we're getting. We're not trying to produce a dramatic effect. Only a small amount is needed to really get this line to start to iron out. And I think we've already gotten quite a good response just from that very tiny amount of Restylane. All right, so I'm fairly happy with this result. Just almost immediately we've actually gotten a nice little elevation of this line here. And the Restylane that's in the skin will be absorbed just a slight amount, so she won't have that tiny little bit of elevation. But her skin is nicely soft, and so I think it's going to respond very well to this treatment. I'm just going to walk around to the other side. And let me just turn your head just a little bit. She's almost trying to develop a lower line here, so I might try to get just a little bit of that too. But we're going to do the same thing. Just inject just